Good morning. I am trying to not use my heating system. I'm trying to go the month of October without turning on my heat for the first time in my life, and I think I'm going to crack October 3rd, and I already want to put my heat on. But anyway, that's not what we're here to talk about. Today, the topic is vaccines, a controversial topic that I haven't spoken about, and I have a guest, a long line of guests, by the way, who is smarter than me. So this is going to be a fun conversation. I have with me Dr. Adjoa Smalls-Mantey. She's a physician scientist, author, speaker, and writer of a book called Anjali the Brave. And it's about a little girl who is concerned about getting a vaccine or a shot. And she's going to talk to us a little bit about that. But she's also going to talk to us about vaccines, the history of vaccines, and maybe some of the controversy around those. And I think we're going to have some fun, and I hope it helps everybody that might be listening. So, Adjoa, thank you for being with me today.
Thank you for having me.
Did I say all of that right? Did I capture you in a decent way with that intro?
You did.
Okay. All right. Well, that's good. So I feel like I set the table okay. So let's just just to get us kicked off, tell me a little bit about the book, and then I want to go back and talk about what caused you to even want to be a scientist at whatever point in your life. So tell everybody about the book and why you wrote it.
So, Anjali the Brave is a book about a young girl. She's heading off to the doctor's office to get yet another shot, like so many young kids do. And she's asking her dad, "Why do I have to do this again?" And at the doctor's office, she learns from her pediatrician about why she is getting this shot and others, and how the vaccines have kept us healthy for so long. So I wrote that book because I know that getting shots can be scary. Even as an adult, I see people in the ED all the time, and we don't like that pinch, or we worry about the after effects, or am I going to feel a little bit sick and tired after I get a vaccine? But it's doing something that we know is also very important for our health and necessary and life saving. So I wanted to write that book to help younger kids understand why they're getting a vaccine, because knowing why you're getting something helps you be less scared of it, and emphasizing on being brave is doing something even when you're scared about doing whatever that is. And I hope that through the history, through learning about how vaccines work, people felt more empowered about getting the shot. Not only the kids, but their parents that are reading with them, their grandparents, or other adults.
Yeah, yeah. Well, I got to tell you, as a child, probably my worst fear was getting a shot at the doctor's office. Every single appointment I ever had, I would ask my mother, "Is he going to give me a shot today?" And she would always say, "Oh,
Mhm.
there's no shots today." And then I'd get in there and I'd get roped into some whatever. I'd get trapped, and then I'd get a shot. I still don't like the idea of it. And the funny thing is they really don't hurt, but there's a phobia. So I see it with my own children over the years. They've been afraid of it. So
Mhm.
there's that part of it, the perceived pain or the actual pain of the needle entering the skin or the vein. But then we're in a climate now where the idea of getting a vaccine it goes well beyond, or the fear of it goes well beyond the pinch of the needle. There's just maybe even a fear of, am I going to live if I get this thing, or am I going to be poisoned if I get this thing, depending on what your perceptions are. Does the book comment on that, or do you have any thoughts on that?
So we don't particularly talk about, am I going to live beyond the vaccine? We do talk about what will happen after you get it. You might have a sore arm, you might feel a little bit tired or weak, but we emphasize that is just your immune system practicing fighting the germ.
Mhm.
And, sometimes people say, oh, the more ill you feel, maybe the better that your immune system is revving up and practicing that germ. But whatever it is, you're getting practice, and it's better to get that weakened form of the infection or have your body practice before you have to face the real thing. The other part of your question was,
The fear that they might be putting into you is actually going to hurt you.
yeah, and I can definitely understand being hesitant about whatever you're getting. I think human nature, we're just skeptical about a lot of things. What are we doing? From the beginning of time, we've always questioned things, and so you've had to explain why you're doing things. The earlier, when we first developed vaccines back in the 1700s to 1800s, people were even nervous about getting the smallpox vaccine with as much as it ravaged the world. And they had to do a lot of public health campaigns and eventually started mandating it in schools for people's safety. But I think there's always a concern, there's a fear, and sometimes, you know, in medicine, things haven't always been right. I get that from the thousands of centuries of medicine that we've had. Sometimes things haven't been right, but where we are now, medicine has come so far along. We've gotten so much better at testing medications, vaccines before they're administered to the general public. So we can rest assured that most of the things, many of the things that we're taking now are very, very safe. And this particularly for the COVID vaccine.
And to your point, vaccines are not new. I thought I heard on a recent podcast that they might even date back to the 1500s with smallpox in certain parts of the world. But when you think about all the things that we've been vaccinated for over the years, smallpox, HIV, polio, measles, mumps, hepatitis. I mean, there's so many. There's nothing new about these things, but over the years, controversy tends to follow the idea of a vaccine, suspicion that it's going to work, or what are the intentions of this. And I think we've just kind of entered into a world where we're really suspicious of that stuff. But we can get more into that as we go along. But go back to when you were a child, or at what point in your life did you decide, hey, I want to be a scientist. This is what I was meant to do.
So for me, it was actually in high school when I started thinking about wanting to be a scientist. I loved science growing up as a kid and watching TV shows like Bill Nye and the Magic School Bus, but didn't think about it as a career until the anthrax scare happened in the DC area where I grew up. And that was very, very scary during that time. You were scared to open the mail because, you know, people were opening their mail and dying from this infectious disease. So after that, I thought, okay, I want to protect myself and others that I love and try to work towards helping people be protected from infectious disease. So in college, I went to college majoring in biochemistry and plan to go on and do basic science research. And then I also thought I love research. I got to do a lot of that during college, but I'd like to work with people as well. So then I ended up doing a combined MD PhD program and want to become a doctor as well so I could work with people and apply what I was learning through science.
So, there's different types of reasons we would get a vaccine, right? Are some vaccines focused more on bacterial issues versus viral issues? And if so, help me understand the difference. Talk to me like I'm in third grade, because
Okay.
you'll lose me with the details otherwise.
Yes. So we have viruses that target toxins, that target bacteria, that target viruses. And what the vaccines all do is that they mimic a part of that bacteria or that toxin or that virus. And so when your body sees that small part of it, whether it's the outside, a protein that's produced by the bacterial or viral agent, your body can start building its defenses against that. And there are different types of defenses it builds. We talk about antibodies a lot because those are little parts of our body that then tag the germ to say this is bad and then bring a lot of other things in our body to fight it. But there are other types of cells that are produced and that are stored in our body that also are ready to fight the virus, bacteria, whatever it is, when we encounter it for real.
Right. So even would snake venom be considered a vaccine if you got bitten by, say, a cobra? If you're going to live, they put an anti-venom into you, correct? I mean, that's the answer to it, is put that in so your body develops some sort of immunity or ability to fight. Is it the same concept?
So the an anti-venom is more like a medication or a treatment, a vaccine you're giving before the you encounter whatever the agent is.
Okay, okay. So given that COVID is so fresh in our minds, not that we want to dwell on it, but it is our reality right now, and I think it's calming down. From your seat, where do you think we could have how do you think we could have handled this messaging more effectively? And the reason I'm asking this question is, in my mind, we politicized something that didn't necessarily have to be politicized. But I also think that we bungled the message. There was so much mixed messaging and sides created, and then there was this whole mandatory. Um, there was something about this whole thing that felt mandatory that I feel like lost people. What do you have to say about that? What are your comments on that? Could we have handled it better, and in what way could we have handled it better?
So I think around the time that the COVID vaccine was being developed and generated, we were at a very heated time politically. So I heard people saying, well, it's being produced under this administration, so I'm not sure if I'll take it. And that's the wrong thing to say. Even some politicians would say that, or very powerful people. But what has to be remembered is that the scientists that create these vaccines, that are doing the research, not only when COVID happened, but for decades before it appeared, these people are not thinking in the context of one political party versus another. They're thinking, I just want to help people because I was in that place, and everyone can get sick no matter what political party you were part of. So I think, partially there was some harm done where people were saying, I don't trust a vaccine under this administration or that administration. But I think also we have to do a good job and should have done a better job of explaining to people why it was important. I think sometimes in certain areas where I live, we got in New York, we got the brunt of the COVID infection first and saw so many people dying. I know so many people that unfortunately died in the first wave and seeing people in the hospitals. So for me, it was very easy to see why this was important because it was scary. It really was like I could lose my life or another family member could lose their life. But I think if you were a little bit more removed from that, it's hard to see the reason why you needed to get this treatment or medication vaccine. So I think there was a lot of coverage about it, but I think more understanding of the effects of COVID when you get it and you do survive, or what it's like to have lost so many family members from this uh, virus. If there could have been more sharing of that and people have just more of an appreciation of that, I think would have helped people feel a little bit more comfortable with the vaccine. And then I think the third thing is to help people understand how the vaccine was made and how it was tested. There's a lot, and I'm, of course, engrossed in that information, reading the news articles that come out about how the testing's done, how many people are testing. But I think if we could say that, you had 10 times more people in this clinical trial than you typically do in a clinical trial, and then, you know, people understand how the vaccine was developed quickly, I think that would make people feel a little bit more comfortable. One thing I do share with people is that the COVID vaccine wasn't created, we had the COVID vaccine in a year, but it is, again, decades of research from the mRNA technology. There was a SARS-CoV-1 virus that came out when I was younger and getting interested in science 2 decades before. So since that time, early around 2002, 2003, scientists were starting to research how to fight this virus, and this was just another iteration of that virus. And then when the actual SARS-CoV-2 that we're dealing with came around, scientists from all over the world were rapidly sharing information before it was officially published, having to go through several months of waiting before it's published in a journal. Information was being shared immediately and rapidly. There was a lot of federal funding for development of the vaccine. The vaccine was developed or being produced at the same time as the clinical trials. And so that was a huge risk that the federal government was taking in making the vaccine so that It would be ready as soon as we knew it was safe and ready to go, but they wanted it available so that immediately it could roll out. Usually you're doing your clinical trials and then you're waiting, then you're ramping up production. And we know waiting for production can be a significant delay. We saw that with the infant formula crisis. So the federal government could have lost so, and other industries could have lost so much money, but because this was a humanitarian, a human crisis, they were willing to put that money there so something could be ready in advance. And then again, the number of people that were in the clinical trials, there were a lot more people than typically are involved in clinical trials. Different stages were happening at the same time. Data was being reviewed concurrently, in real time. So this all allowed us to have a vaccine within 1 year of the virus popping up. And again, it is truly a miracle that we had that because we lost here in America over 1 million people to COVID. And it could have been so much more, not only here, but around the world had the vaccine not been available when it was. But
Yeah.
again, so many people didn't have the opportunity to get the vaccine.
Yeah.
That's a loss.
Yeah, I mean, the reality is we can debate the intentions and all that of the vaccine and politics and all that, but at the end of the day, people did die, and a lot of people died. And I sit here from my seat and I wonder, what are we doing when you think about the people that did die statistically? An aging population of people with pre-existing conditions, many of whom were living in less than desirable situations, whether it's a condemned building or mold or whatever. They're not in an ideal environment. I wonder what we're really doing to address those things. I don't think and with a little bit of an aside here, I don't think as a country that we are set up to take care of our elderly and our aging and our unhealthy people. And so those continue to be problems. And we created this stir around a vaccine, and we got in a fight about a vaccine. In the meantime, all these people were dying. I am concerned though about what we're doing to really address those other situations. But aside from that, I wonder to what extent money clouds this whole thing and the messaging and the manner in which this was communicated. I recently watched, and I referenced on another podcast. I recently watched that series Dope Sick about the opioid epidemic, basically the Purdue Pharmaceuticals and OxyContin and all that stuff. And you think about how that got approved through the FDA and all the controversy associated with that. And then I look at all of the medications, and these aren't vaccines, but that are marketed on TV now. You just didn't hear that stuff when we were young kids, and all the side effects associated with what does get approved. So, in my mind, as somebody who doesn't take this medicine, I look at it and say, well, look at the stuff that does get approved and does go through these processes. There's still risk associated. So, whether the COVID vaccine was approved quickly or not, I don't think the threats are any less. I don't know if what I'm saying makes sense, but we made a big deal out of something, but we have issues with products, drugs, food that gets approved through the normal process. So, and we seem to be okay with that.
Absolutely. I mean, there's always a benefit and a risk to almost anything that you're taking. So I think the question that everyone has to ask themselves is, what is the risk of getting the vaccine? What is the risk of not getting the vaccine? And especially in the earlier days with the, initial variants, beta, delta, you know, there was a lot of people were dying, and young people as well, not just 80-year-olds, 70-year-olds, 40-year-olds, 50-year-olds. It broke my heart to go into the hospital, even though I'm a psychiatrist, because of the nature of the work I do, working in the hospital setting, seeing younger people with several kids that were sick, that were intubated due to having COVID. So I think you have to ask yourself, what is the risk of the COVID vaccine? The risks were very relatively low for getting a serious illness. And there was a lot of data. And because the number of people that were getting it, we got data even faster about whatever those risks were. But the risk of getting COVID and not only getting sick from the initial infection, but having long COVID, or for children, the multisystem inflammatory syndrome, um, those consequences as well. That was for me a higher risk, and why I would, and did choose to get the COVID vaccine, because even if I survive, I don't want to have any long-term consequences of breathing problems or other things that could happen from getting the illness. So you do have to take everything into account, but it's just like that for your diabetes medication, your blood pressure medication. They all psychiatric medications. A lot of the medications that we give have side effects, and some of them can, really impact your physical health as well. But you're thinking about what happens if I don't take this as well. So
Right,
that's something
right.
that we keep in mind.
You brought up smallpox earlier, and I don't have the exact stats, but when it was a major issue several hundred years ago, I think it was something like 70% of the people that got it died. It was a huge number. And
Mhm.
then when the vaccine was introduced, there was a 2 to 3% mortality rate. If you took the vaccine, 2 to 3% of the people died of that. And it became a focal point. But the reality is, if you didn't take it, your odds of death were significantly higher. And so I think we all have to use our common sense, better judgment. Is there risk? Yeah. Well, there's risk in eating McDonald's every day, and there's risk in drinking Budweiser every day, and there's risk. So over time, we are chipping away at our bodies, eating and drinking the wrong things every day. So yeah, there's risk in the vaccine, but I would argue that the reward outweighs the risk. In my personal humble opinion. Um, but let me ask you this. I mean, when you think about it, you also do a lot of work, and I hope you're okay talking about it. You do a lot of work on the psychological side, and you're a therapist. What are some of the things you've seen or observed over the last couple of years that maybe you didn't see prior to COVID? What kind of conversations are you having today that you didn't have, 3 years ago?
So I am an emergency psychiatrist. I work in the emergency room settings, and I see people that come in a crisis. So I've always seen people with depression, with mania, with psychosis. Those are the things I tend to see. But now the reason for the depression that people are coming in is a little bit different. Some of it's interpersonal conflict, but a lot of people are pointing out I'm lonely. And now, as we're approaching anniversaries, I'm starting to see more and more people mention it's the anniversary of someone dying due to COVID. So that definitely is a real thing. The loneliness, the isolation, it's starting to get to people. I think initially people were like, oh, it's my time. I'm going to recharge and do certain things. But then for people that didn't have the ability to still stay connected through online resources through that time and are struggling to reconnect now, that's a huge factor for them. And I think, I love many aspects of our hybrid world, but for many people, they haven't been able to reintegrate into meeting people in person, or really forced to do things with other people. And we need other people. So I think that's a huge thing that I've seen. And then also, we know that there's a drug crisis, an opiate crisis, and the types of drugs that I'm seeing more methamphetamine, definitely seeing a lot more fentanyl, um, as well. When we do our urine toxicology studies with individuals, and people are surprised that whatever they took was laced with fentanyl, and that can have a serious effect in, physically, but definitely in the addiction potential of whatever drugs that they're taking. So I think just more drug use, the type of drugs used, a lot more loneliness being identified as a reason for depression.
What's done is done, and obviously we can't change anything. But I wonder if we could go back in time, if we would have handled this differently. The reality is a lot of people died. It was a real thing, and we created a vaccine that curbed it. At some level, it curbed it. And people are still dying even today. I
Mhm.
believe at a lesser rate, but it's still happening.
About 350 people are dying a day still from COVID. That's a lot.
It's a lot. So it's still happening. My question though, and I had this question in March of 2020 when it happened. I did one of my clients, he sent me a text and he asked me, he said, "Are you going to say anything about this lockdown?" And at the time, and I've said this before on these recordings, I didn't know what to say. I don't know anything. I have no idea. I'm a business guy. Who am I to
Mhm.
say anything about this? I'm ignorant when it comes to this. But one of the things I did comment on was my fear that we are going to run into a mental health crisis by locking everyone down. And I still to this day feel that we could have handled it differently rather than apply the solution to everybody. Could we have compartmentalized solutions for areas that were more at risk, people that were more at risk, and put programs or systems or offerings in place that took care of them and didn't isolate them. And the reason I say that is if you just go back to, when we were kids in school, on the playground or in a class, usually if you had a kid misbehaving in class, usually that kid was dealt with separately. It was the
Mhm.
whole class was not typically dealt with for the behavior of one. And I know this isn't behavioral, but I look at, cities like New York, to some extent Boston, areas where you have older buildings, older heating systems, maybe poorer areas where you don't have the same access to the same food or medication. Those populations of people were more susceptible. Could we have done a better job supporting that rather than blanketing solutions? And I wonder to what extent it's escalated our mental health problems and our drug problems in areas that maybe we otherwise wouldn't have had those problems. I don't know. What's your take on that?
Yeah, that is really hard. I think, I understand one of the reasons that we had the lockdowns was because there wasn't enough personal protective equipment at that time. So, even in hospitals, we were rationing masks and wearing them for weeks, sometimes weeks at a time, optimally maybe 1 week at a time. So there wasn't a way to keep ourselves safe if we were engaging with other people. I think then as we were able to ramp up production of the mask, and if people were very compliant with them, then possibly we could have had a little bit more social engagement during that time. But I think it's really hard to know what would have been best, especially at the time when we were just all in crisis mode. But I think one thing that would have been critical to allow that happening would have been before the vaccines coming out, would have been everyone diligently wearing their mask at that time, because that was a very useful and effective preventative measure, but there was even a lot of resistance to that.
And that's where I think our messaging could have been better. That's where the politics kind of screwed us all in a lot of ways, where it became, an us against them, or you're one of them. And, I wore my mask. I wear my mask like I cover my nose or I've covered my mouth if I'm going to cough, or I don't
Mhm.
chew with my mouth open at the table. I would wear a mask because I don't want to be the person sneezing all over the food or coughing in somebody's face. It's rude. It's not polite. It's not polite to chew with your mouth open. And at the
Mhm.
time, I felt like it wasn't appropriate to walk around without a mask. And so if I was going somewhere, and I did. Now, my wife went out for a walk during COVID, and it was probably 6 months into it. And she was walking outside without her mask. And somebody pulled over and went crazy, screaming at her as if
Mhm.
she was a criminal. And she didn't
Yeah.
realize they were talking to her. And there
Mhm.
were other people without masks, but this person was in their car with the mask on. And who knows what they were going through or what they experienced. But
Yeah.
such a divide between people. And I wonder to what extent, how could we have messaged this better? Shouldn't we have known better at the top? Shouldn't we? There are times where I started to doubt the intentions of our politicians. I started to doubt the intentions of our media outlets. I believe that you can stir up a lot of attention and a lot of money by creating fear and doubt in people. And if you
Yeah.
if you can create that type of controversy, people will either adapt or they'll fight. And either way, you can profit off of that. And so
Mhm,
I just wonder to what extent we've got to get control over this stuff. There's so much misinformation out there right now.
mhm.
And I know we're moving beyond the mayhem, but it's still a real situation. What do you see as some of the challenges going forward with talking about stuff like this? Or what about the next thing that comes about, the next version of COVID or the next virus that we don't even know about right now? How do we get out in front of this stuff so we don't fall back into what happened over the last couple of years? I don't mean in terms of avoiding the sickness, but avoiding the divide between people. How do we do that?
I think it's, honestly, the politicians and news, casters, people in the media, they are on the TV and they're more easily accessible. But that's where the responsibility of individuals that are public health officials or like you, me, that have the ability to reach the public, it's our duty to responsibly share information. So I think, beyond just COVID, we've learned, hey, masks can reduce respiratory infection, the spread of that. We know incidence of the flu went down during the past 2 years because people were wearing masks. So reinforcing these are general good healthcare principles. Lots of countries, I would say in Asia, people would wear a mask if they had an respiratory illness, for years, decades before this, not just it wasn't new with COVID. So I think it was easier for them to accept and to wear this. And so it's going to be a lot of public education. I remember there was another illness that happened. I can't remember exactly what it was a couple of years ago, but that's when they started doing public health campaigns about sneezing into your shoulder
Yeah,
or
elbow.
into your elbow,
Yeah, yeah.
So it's that just re-educating the public about things. Hand washing, when that was introduced over 100 years ago, that took a lot to convince the public this was something necessary, important to do. So it is going to take a lot of constant messaging, I think, on a smaller scale, starting with younger children that are coming up, because they'll remember this for a very long time. But I think it can be done, but I just, we all want people to be responsible with what they're saying and not cause that divide and be divisive. Unfortunately, that has been what has caught people's attention. And I can only hope that people are more responsible, learning, knowing that people's lives are on the line from the information that you're spreading.
Is your job harder as a scientist and as a uh, psychiatrist today? Is it harder today than it used to be, given all of the information that people have access to, true or false? Is it making your job to be successful harder?
In terms of psychiatry, I think because of the setting where I see people, my job has relatively remained the same because I'm seeing people at a moment of crisis. Immediate help is needed. People aren't going back and checking and researching and looking into things so much. Maybe a few people that have thought about coming into the emergency room have looked up some stuff. So, but I'm not going to say people don't challenge me. A lot of people do say, I don't need this or that, for sure. But maybe that's just coming out of their own natural personality, but not necessarily with a lot of other, well, I heard this and that. So it's not so much misinformation I'm fighting. It might be more people's own true beliefs or thoughts or concerns that I can have a very good conversation with them. And again, a lot of people may not do what I suggest, but I feel like for me, I do have the opportunity to have a discussion with people around what their concerns are. And because they're at a moment of crisis, they might be a little bit more open to what my expert opinion is.
Got it. Got it. Got it. So, what do you see the future? What do you see going forward here, Ajwa?
I hope that when it comes to the matter of infectious diseases, people remember lessons that we have learned from this pandemic about basic hygiene, from washing hands, sanitizing, wearing a mask when you are, um, have the sniffles or something, even if you go to work. Another thing I hope that happens is in the workplace, or that there's a culture more so from the administration. When people are sick, give them time off to heal and recover so you are not spreading illnesses to other people. That was definitely accepted for COVID. It's a policy now. It's 5 days off that you should be away and isolate and not come to work. But before this, I remember struggling and coming to work while sick, and sneezing. And, you're not thinking so much of how you're really affecting other people, but you are. And now that I'm in healthcare, I'm a little bit more cognizant of that because I am around more vulnerable, ill people. But I hope with yeah, from the top down with administration, there's more of an emphasis on taking care of yourself physically because of what we've all been through this year. And then I also would say mentally as well. There were a lot of stresses that people had. For some people, COVID was a time to decompress. For a lot of people, it added on a lot more stresses, but some people have found ways to adapt. And coming now, as we're on the almost on the other side of this, or in the new era, the new normal, people have developed new habits to better pace themselves. So I hope that continues. But um, those would be the three things I would say: good hygiene, taking time off to rest when you are ill, and better giving your time self time to deal with stress, and appointing your day, or your week, your month, or your work environment in a way that helps you to manage your stress better.
Yeah, and you mentioned just taking better care of ourselves. Just a few family members over the last couple of years have just gotten sick later in life, and some of them didn't take great care of themselves. And so all of a sudden they're at a point in life they're not going to get another shot to redo it. And
Mhm.
so the damage is done. Here's your diagnosis. Let's try to keep you comfortable. And my wife and I were talking this morning. I think, we're 50, soon to be 51. And I always say, I'm like, we've got to take care of ourselves now, mentally and physically, because at some
Mhm.
point, you're 70, 75, 80, you're not going to get a chance to rebuild what you might have been destroying over the years. And I just think it's so important that we focus on that. What about you, though? How do you maintain your clarity, or your peace of mind as you do this kind of work? Because a lot of the folks that come to you, I assume, like you said, are going through crisis. They're not in a good place, and you experiencing what you experienced in the hospitals over the last couple of years, a lot of people dying, a lot of sadness. And how do you keep yourself um, focused and clear and at peace?
I would say being connected to other people is very important. I've always, no matter how busy I am, I also try to make sure I prioritize time with my family, my friends. We're social beings. We need other people. Some people don't like to be around a lot of people, but we need one or two other people. And then I would also say there are other tenants. Good sleep is very important. So that has to be prioritized. There might be a couple of nights here and there because you're working on a project, have an event, whatever. If you have a newborn, that you may not get a lot of sleep. But in general, try to get as much sleep as you can. Don't consistently cut into your sleep. And sometimes I wasn't always the best of that, but definitely now I do prioritize my sleep because, like you say, you can't necessarily catch up on sleep. And you can try to be healthy, but it's hard to make up for bad health. There are other things like exercising as well. I definitely prioritize that because, again, this is the one thing that you're going to carry your body till the day that you die. You'll be with it. So you want to make sure that you're doing the best for it that you can. There's principles of good and healthy eating. And we don't necessarily have to stick to a strict diet, but it's everything in moderation, and remembering and finding a way to eat healthy in a way that is satisfying to you. So these are actually some of the principles of lifestyle medicine. I am a certified lifestyle medicine physician, but that abstaining from bad, overindulging in certain substances like alcohol, tobacco. Those are all very important things. But yeah, I would say the most important for me are good sleep and exercise.
Right, right, and
That's
in the end,
critical.
that's bolstering immunity, correct? I mean, when you think about it.
Yes.
So, whether you get the vaccine or you don't get the vaccine, odds are you're positioned better if you're sleeping, eating right, exercising, all those things you're
Yep.
talking about. What
That's
about
when our body heals itself. That's why we always sleep when we're tired, when we're sick, because it gives our body a chance to regenerate.
two more questions and I'll leave you alone. Two more questions, but I could talk about the healthy side all day long. Um, are we doing enough to promote? I mean, if every time I turn on the TV or I don't, there's always something on exercise and diet and some new craze that's going to change your life. Probably well intended, but a lot of it is money driven, which is fine. Doesn't mean it's not well intended. And then there's
Mhm.
the other side where we're marketing, you know, alcohol or fried food or, like all the quick fix medicines, for example, again, in the name of money. But at the end of the day, are we doing enough to really promote positive choices, sleeping, healthy food choices, hydration, exercise, mindfulness, all those things? Are we doing enough in that regard, or are we not?
It's interesting that you mentioned the dichotomy of the things that we are exposed to. I feel like now there is a lot more emphasis on healthy living and not only relying on supplements and things. So while there is more, there's not enough. That's maybe splitting hairs, but I will say that from what I've seen, even with celebrities or food recommendations, people talk about the Mediterranean diet. It's not one thing, it's about eating whole, eating healthy. A lot of celebrities will talk now about their exercise regime and show you and did physical fitness challenges maybe during the pandemic to emphasize that. So I like that I'm seeing that a little bit more um, in general media, but we are shown specific things. And as a doctor, I do believe that there are benefits to medications and that vitamin supplements, they can be helpful. But then, and sometimes we do need to relax, and there are other things that people use. Everyone's trying to sell something, everything's a business, and so it's not to say like alcohol is absolutely wrong, you can't use it, can't drink it, but you shouldn't use it in excess. If you use it in excess, it will have um a problem. So I think with the messaging that is used in things like you can say for alcohol, then maybe it shouldn't be tied into, oh, this is a way to cope with a problem, but show, okay, this is something that you can use when you're having a good time. But when you're showing and you're tying it to, you're using it to cope with feeling bad or cope with a bad experience, as I sometimes see in certain TV shows and things, I think that is where you have a problem. It's how you're trying to show when people should use and integrate these things. That's when unhealthy habits can develop. And that is still a problem today.
Got it. What haven't I asked you? Is there anything that we haven't talked about that you wanted to comment on?
I think we've covered a lot. We've talked about vaccines, how they can be helpful for you. There are a lot of concerns about vaccines. One thing I will also mention is that people had concerns about fertility with the vaccine. The vaccine doesn't affect the COVID vaccine, doesn't affect fertility. There has always been a concern with autism, with vaccines that started from a paper decades ago that has since been retracted. The lead scientist, lost his medical license as a result of that. And so that is still misinformation that I face and have to combat today. Um, and the thing is that again, vaccines have been around for a long time. There are side effects. You might feel a little bit sore at the site. You might feel tired, and there are some other more serious side effects as well that can happen from vaccines. But largely, they are safe, and healthy for you. So I just want to re-emphasize that fact. We covered mental health, just making sure that you um, are getting rest, focusing on taking time to rest when you are sick, and also in your daily life, not being overburdened with things, seeking help when you need it. So I think we've covered a lot.
All
Thank
right.
you.
Now I have one more question. I have one more question. I'm sorry. You just reminded me of something. How do you guide people who need more information but don't know where to get it? I mean, I'm just some guy doing a podcast. I don't have your
Yeah.
credentials. You have the credentials. I'm just somebody talking. But I'm constantly out there trying to find information. And I might listen to podcasts or read a book or a TED talk or go listen to somebody speak. And I'm always rinsing this information against that information. Where are the consistencies? Where are the inconsistencies? But it starts with my curiosity. What do you say to people who need to know but don't know? Where do they get information? What's credible information? Any thoughts on that?
So I would say for medical information, one place, of course, I'll say the CDC website. There's a lot of information on there. Everything that you want to know, you can find and sift through. But if you want something that might be more um, easy to digest. Sometimes, like, again, there's so much information on the CDC website, but a lot of times university websites for hospitals will have, they may not cover every single topic, but a university might be a health center of excellence in a specific field. So if you're doing a Google search, but you find information from, I'll say, NYU or from another large hospital system, I would rely on those pieces of information as well. Those are coming from other doctors, verified scientific information. There's also a number of other websites that present medical information for the lay public very well. WebMD are good sites, Medline. So those are places that I would and do turn to when I'm looking for general information about something. You do have to be careful what you're finding on, a YouTube page, a random podcast. Like even for us here, um, if you're not sure so much about the background, you can trust medical institutions.
What about people that want to reach you? For what reason should they reach out? How do they find your book?
Yeah, so you can find me on Instagram at Dr. Adjoa. Our book is available on Amazon, Barnes and Noble, and other retailers where ebooks are sold. You can follow our page at Anjali the Brave or go to our website, www.anjalithebrave.com. So would be happy to connect with anyone. And yeah, it's been great being here.
Thank you, Dr. Adjoa Smalls-Mantey. Did I pronounce that right? Adjoa
That,
Smalls-Mantey. I appreciate you being a guest. I enjoyed the conversation. Thank you so much.
thank you.
Okay.